So welcome back to Rnpntutors USA. Today we're going to talk about the nursing process and how to build a care plan. We're literally going to talk about a patient, assess the patient, and then build a care plan from there. So some of the things to remember when building a care plan: you will need some way to get your hands on a Nanda list, or a nursing diagnostic set of labels for client problems. Once you have I suggest a nursing diagnosis handbook, only because the nursing diagnosis handbook not only lists the nursing diagnoses, but it gives you related to or etiological factors, as well as you'll get some of the listing of appropriate nursing interventions and nursing outcomes from the nursing outcomes classification set. And so I think it's an important idea for you to first have a nursing diagnosis handbook. I happen to like the handbook by Ackley and Ludwig, I believe the authors are, but there are many out there. Or you can also use the Swearingen all-in-one care planning book. So having said that, I thought we would examine a pediatric client. So our client is going to be Joel Jones, who is a 4-month-old male infant. He's been admitted 2 days ago now with intussusception of the bowels, has severe colicky pain, some projectile vomiting, dehydration, jelly-like stool. He's had fluids administered, had surgery for repair of the bowels. Currently has bowel sounds in all 4 quadrants, is progressing oral feedings, has gotten water and glucose has started, and mom is cribside. The orders are that the child has been ordered Pro-So-B, 240 ml. He's been able to take in. He has output of 60 ml. Auxiliary temperatures of 96 degrees Fahrenheit, an apical pulse of 132, respirations at 34. On the Flax scale, we assessed pain at a 6. Current weight is 6 kilograms. So just providing information that we're going to use in our care plan. So let's get into some of our information. So we're going to first examine our assessment information. And I'm sorry, I probably should have wrote assessment here to ensure that you can see the information. So a lot of what I just read was just information that the nurse is collecting, just data that the nurse is going to be looking at. So we had, for example, feeding was Pro-So-B. We know that the temp, we had said, was 96 degrees. It was an auxiliary temperature that was taken. We have respiratory rate at 32, we had said. An apical pulse at 132, just turn it at 34. So that keeps 32 at 32. And then we had assessed pain, Flax scale of 6. So just going over some of the information that you would note in assessment. We spoke about the incision, and then of course I have some of this information posted above. So the incision we said was clean, you know, the edges, because we always want to look for approximation. This is a surgical incision, approximated edges, slight redness at the incision site. So just going over some of the assessment, assessment information that was gathered. So of course, whenever you're doing or thinking nursing process, thinking care plans, remind yourself Adpie. So assessment is the first step, and that's where we're at. Then of course there's diagnosis, planning, implementation of what the nurse will do, and evaluation, of course. So we're in the step of assessment, and we're evaluating and clustering, validating the data, collecting information, because from this information that we're collecting, we are then going to develop a nursing diagnosis. So let's move into talking about the nursing diagnosis. right? So moving into talking about diagnosis, but this is a nursing diagnosis, not the medical diagnosis, but the nursing diagnosis, and you use Nanda labels or Nanda diagnostic labels in order to not only identify the client problem, but to label it. So your nursing diagnostic statement, right? Nursing process now leading into the care plan, you must have certain things. You will have a label from your Nanda listing, and you can always get this from your nursing diagnosis handbook. So for example, just moving through information now, because since I'm saying that you should go to your nursing diagnosis handbook, you want to find a nursing diagnostic label that is relevant to your areas of care within your assessment information that you're going to be able to attend to the patient, right? So for example, we had said that the client scored a 6 on the FLAC scale. FLAC is a scale that we can use to assess pain in the non-verbal client. And in this case, we have a 4-month-old male infant who won't be able to tell us my pain is at a 6 or a 10 on the 0 to 10 pain scale. And so we have to then use something that is applicable to this client. And so what would be appropriate is the FLAC scale. So we said on the FLAC, pain was at 6, let's say, right? And so from our nursing diagnosis handbook or any other Nanda listing, we could use, for example, in assessing our client, we could find evidence to support acute pain. Right? So first thing you need whenever we're dealing with making up a nursing diagnostic statement or Nanda label, an applicable label, because we are labeling the patient's or client's problem. So whenever you think nursing diagnosis, you should be thinking, what problems have I identified from my assessment information, and what label, what am I going to call the problems I've identified? So in this case, a FLAC scale of 6 means your client is in pain. I'm a stickler for attending to pain, right? So you then would look in your Nanda listing for an applicable label that says pain, right? If it was chronic pain, you could have used chronic pain as well. And so you're going to say acute pain, which is the first thing, right? It is your Nanda label. And you've gotten that from the Nanda list. So I didn't make that up, right? We have an actual organization of nursing scientists and researchers that develop these labels. And then these labels are associated with both outcomes for the client and interventions that the nurse will perform. And so if our first thing, because we have 1, 2, 3 parts to a nursing diagnostic label. So first one is the labeling that we get from Nanda, and that is acute pain. The second is our etiology of the problem. If you don't remember what etiology means, it's our origin of the problem, or what is causing the client acute pain. And we tend to write R/T, meaning the related to factor. So in this case, this client had, right, in assessment, they had or came into your facility for intussusception of the bowels. That means the bowels have telescoped on each other, or they've slid up into each other like I'm doing in my sleeve right now. So my sleeve could be straightened out like this, real simple, but it will help you. This is my sleeve, this is the bowels normally. With intussusception, the bowels fold into itself. And because of this fold into itself, right, the contents, what is inside, can't continue because we have this intussusception or telescoping of the bowels onto itself. And so they go to surgery to have it repaired and to smooth it out, if you want to think about it. That's a very simplified explanation, but it helps you to understand what we mean by the telescoping or the folding in of the bowels. All right, having said that now, and roughed up the outfit, let's get back to Nanda label. So again, the first thing is the acute pain, right? We got that from our nursing diagnosis handbook. We need an etiology of the pain or a related to factor, and that is going to be, in this case, it could be related to tissue trauma, right? There's trauma to the tissue from that surgeon's incision, that surgeon's cut, right? So that could be a related to factor. Now, thirdly, so you need a Nanda label, number one. You then need an etiological factor, or what your problem is related to, what is the origin of the problem, and then you need evidence of the problem. And so in some books we call this the as evidenced by, AEB, or it could be as manifested by, right? Because we're using shortening. So it means as evidenced by, AEB, or it could be your as manifested by, AMB, but you need evidence. So three things. You need a Nanda label. In this case, it's acute pain. Your second thing is an etiological factor, or are you related to? And in this case, you're related to, it's related, your infant has acute pain related to tissue trauma. Your third, you need evidence. How did you know the client was in pain? And what is the evidence of this pain? Well, first of all, your evidence would have included a FLAC scale of 6, because you can think also of evidence as signs and symptoms as well, right? FLAC scale of 6, you have the literal incision, so you have eyeballed that there is tissue trauma, for example, right? The child was a bit fussy while you were doing the dressing change. Can't remember what else, but maybe some grimacing. We said something about the legs being up upon palpation of the abdomen and things like that. So we have some evidence of pain. And so this is how we progressively build our care plan. We assess the patient and we document and collect that information. We validate it. We make sure what we've collected, right, matches this person, and what we're thinking about as problems are appropriate. We then think of how to then address or attend or care for this client, and so we develop appropriate diagnostic labels or nursing diagnostic labels. I have to ensure that you understand we mean nursing. And this is the planning phase, right, of your process. And in this planning phase, we are developing our nursing diagnostic label in order to develop outcomes. Because if this is your problem, then what is going to be my goal for you? I need to then reduce this problem or resolve this problem, solve it in some way. So we're just going to start with this first acute pain, nursing diagnostic label. Now, if we are setting outcomes for our patient, whenever you think outcomes, the outcome is the same thing as the goal. In your nursing questions, the outcome is the same thing as the goal. Outcomes have to be SMART. If you keep the little SMART acronym, you'll stay on target, because this is our scientific part of nursing, and so it's very specific. Your outcome has to be specific. Your outcome has to be measurable. So there has to be an objective outcome so that we can measure it. So that if there's a nurse in Taiwan or Japan or Switzerland, and there's a nurse in America or England or the Caribbean, they all function from a universal scientific standpoint. And so it has to be specific, it has to be measurable, it has to be attainable. What do I mean by attainable? If your patient cannot walk, then a goal for that patient can't be to take 10 steps to the door and back because this person can't walk. So that wouldn't be an attainable goal, right? Our goal has to also be realistic and reasonable. And it should have a time factor. So just going back through the basics and fundamental principles of nursing. Now, whenever you think an outcome, first thing should come to mind. I was going to say patient will. You want to say that the client will. So that in your mind, you're specific as to who needs to meet the goal. So in the case of our 4-month-old infant, Joel Jones, who we said had acute pain, and we used the words acute pain direct from our Nanda listing. We then found a related to factor etiology of the pain, and we stated or documented or made obvious our evidence. So now that we know that the client is in pain, what can the nurse do for the client? The client will, for example, have or experience reduction in pain as evidenced by a 3 on the FLAC scale, right? That could be one of our goals. It's pretty specific because we want a reduction in pain. It's measurable because we stated that the pain is going to be reduced to a 3, right? We're now going to make it a little more reasonable and place a time factor, right? So client will experience a reduction in pain as evidenced by a 3 on the FLAC scale, and we could say something like within an hour of ordered pain medication. And I hope you're able to read this. So we're saying the client will experience, I put have just for shortening, but the client will experience a reduction in pain as evidenced by a 3 on the FLAC scale. And as far as our time, it's within 1 hour of the ordered pain medication. So we have a time factor, it's realistic, it's reasonable, it should be attainable, right? So this is an example of how we would set up the outcome or goal for this patient. And this is just one diagnostic statement and one goal, because the idea is just for you to get the flow of how this works. Now, having decided, so again, you need to remind yourself, Adpie. So we've done assessment, check. We made a diagnostic statement, check. We're in our planning phase or stage. And so far in planning, we've worked on the outcome, right? So now that we've set the goal for the client, how will the client achieve this goal? The nurse needs to do something. And so we're moving into our step of intervention or implementation. We're now going to discuss what the nurse will do. Right? This E just came in handy. It really was for evaluation. So we're going to talk about what the nurse will do, because that's what we mean by nursing intervention. What will the nurse do that will move the patient toward achievement of the outcome? Right? So what did we need the patient to accomplish? We needed a reduction in pain. So what the nurse will do is administer, for example, the ordered pain medication. That could be one of the things the nurse does. But another way to think of this is one of your interventions for every nurse is that the nurse will assess. Right? So in this case, if the nurse will administer the ordered pain medication, and I believe our ordered pain medication is Tylenol, as seen, then the nurse will assess pain level, right? Because you want to assess pain level. We had assessed earlier because we know it's at a 6. We're going to give medication. We need to assess again. so that we find out whether or not our intervention of giving the medication was effective. Are you with me? Right? So the nurse will assess pain level is also an intervention, or nurse will administer ordered pain medication just for this one Nanda diagnostic label of acute pain related to, what did we say, tissue trauma, right? Evidenced by the incision and the pain and grimacing and all the other things we listed. Something else the nurse could do to reduce pain, maybe the nurse could offer the pacifier, because we did say that this is a pediatric client who is 4 months old, who's having pain. So now that we've discussed intervention, then we would move into evaluation, because again, talking about the care plan, and you're keeping your Adpie in mind. So we assessed, we developed the diagnostic statement, we planned and set our outcomes that was SMART, specific, measurable, attainable, realistic or reasonable, and had a time factor. And now we spoke of the intervention of the nurse administering that ordered medication, the Tylenol. And then we must evaluate. We must try to determine how did the patient do? Was the goal met, right? We said the nursing intervention is going to move the patient toward achieving the outcome. Well, we now have to see, did it happen? Was the goal met? Did the client achieve the outcome? Did the client partially achieve the outcome, or the client did not achieve the outcome? And we have to then reassess and re-diagnose and re-plan and re-intervene until we get it right, or until we move the client to their highest level optimal functioning at their state where they're at. So just quickly getting into evaluation, just want to talk a little bit about our evaluation phase of the care plan. And again, evaluation is where we literally justify what we had chosen. It's where we see whether or not the outcome is met. So this is just one quick way of going over nursing process and how to develop a care plan. Remember that as nurses, we don't spend the time to make up a diagnostic label. We can get that from a nursing diagnosis handbook. You can get a pocket version of the handbook and carry that with you. Many of the electronic medical record systems will already have these things, and you're just checking boxes. But for school, and in order to answer Nclex questions appropriately, you must understand. If you work in areas like home health, where you, the nurse, RN, develops the plan of care, it's another area. If you work MDS, collecting information on residents in facilities, you're developing your plans of care, and we're always working through care plans. It's just that depending where you work, it may have already been created from scratch, and each day you're just customizing to the patient in front of you. Either way, you have to get it. So again, you assess the client, you cluster that information, you validate it, and you choose appropriate nursing diagnostic labels for each client. Again, nursing diagnostic labels must have the actual label that you get from Nanda, you don't make it up, a related to factor, and nursing diagnosis handbooks give you examples so that you're able to choose appropriately, and they'll define them for you, and then you'll find appropriate nursing outcomes from the listing of nursing outcome classifications, and then customize and address your nursing interventions to meet those. So thanks again for watching. Don't forget to like, share, subscribe, and enjoy our other videos.